I'd like to ask you permission to use this video for educational purpose and on
Yes.
internet. Now, tell me about your symptoms before the surgery.
I was in extreme pain. I couldn't walk. I couldn't sit. I couldn't stand. I couldn't sleep.
How long has that been going on?
9 months.
9 months.
Yep.
And your pain, 1 to 10, how bad was it?
It was terrible.
Terrible.
It was terrible. I couldn't stand it.
Can you show us where the pain was?
Yep. It was right here and down my leg all the way into my feet.
Yeah, and we confirmed that it was your sacroiliac joint. Please have a
Yes.
seat. That's causing the pain. Do you remember how we confirmed that was sacroiliac joint? How did we?
You did an MRI.
Okay.
I think that's all we did.
No, but what about injections?
Oh, yes.
Yeah.
We tried those injections.
And they
didn't.
temporarily helped.
They only help until the Novocaine wears off.
Exactly, and that is exactly why we call them diagnostic injection.
Okay.
We numb it up to see if pain goes away. So we did multiple injection, and just while Novocaine was working, the pain went away, but then the pain came back.
Yeah.
And then about 4 months ago, we fixed it. Do you remember the surgery?
Yes, I do.
Tell me about it.
Well, the first day was great. I went home. I had a lot of medicine in me, and but boy, the second day, I knew I had had surgery.
Okay.
It was a long recuperation. I mean,
Okay,
that
yeah.
month of not being able to walk, it sucked.
What did we tell you? What you should walk or how you should walk?
I was
after the
just
surgery?
supposed to put no weight on that foot at all.
We call it the non-weight bearing ambulation.
Okay.
Did you use a device to walk?
No, my other leg wasn't strong enough, so I used a wheelchair.
Wheelchair.
But my husband is very inventive.
Okay.
He hooked up a rope in the bathroom that I could grab onto and lift myself up and onto the cot.
Generally we say to people that they should use a walker, but you had some problem with the other side.
Yes.
And generally people do ambulate with a walker, but in your situation it was a little different.
Yeah.
Now, how's the pain?
Now it's gone.
Now it's gone?
Yes,
Tell me about it. When did you notice pain is gone?
Well, I started physical therapy after 6 weeks,
Okay.
and that was pretty tough.
Okay.
After I'd been in therapy for about a month, then the pain started. I really started to notice that the pain I was getting was only from working the muscles. It wasn't the same pain anymore.
Yeah, and this is the screws, the 3 screws, we call that trident system that we put it in.
Yes.
So, and it's in good position. So after a month, start walking or something
Yes.
like that?
Okay. Very slowly. She got me on crutches, and then it went pretty quick after that. I was only on the crutches about a week, and then I was starting to walk, and I was gingerly walking the first couple weeks, but now I can do everything. I can walk, I can drive. I don't wake up in the night anymore, take an aspirin. I take a couple Tylenols, but that's usually after therapy because we're working my legs and my hips pretty hard.
So, and you were very excited that, that those limitations are gone that you had
Yes.
before the surgery.
Well, I had no life before the surgery, and now I'm starting to get it back.
Yeah,
I gave up my summer, but it was well worth it.
Okay, very well. So, that pain that was in the back and the legs, how is the leg pain?
There's none.
None, gone.
No, it's gone.
But you still have some numbness in the foot.
Yes,
And
my feet.
Yes, sometimes if numbness is related to that problem, sometimes numbness take a little longer to go away.
Yes,
But
that's what Monica told me.
Yes, yes.
Yep.
Well, I'm so happy that it worked for you.
I'm happy. I was excited to come today to tell you
Yeah.
because I really feel that good.
And tell me about the incision of the...
You can't even see it. When I first had the surgery, there was a knot like about this big, and it just kind of popped up. But within the first week, that went down, and it took a while for my dressing to fall off, so I didn't see it for a while. And when I did, there's just this little tiny cut.
Tiny cut.
It's amazing what you did in there with that little tiny cut, and you can't even see it now.
Well, thank you so much. I really appreciate the testimonial.
I appreciate you, Dr. Abbasi. Thank you.
Thank you very much.